Human Services, somebody mind closing those doors? And Chairman Strickland, I certainly would appreciate if you wouldn't mind saying a little prayer for us, get us started. You're in mic number 1.
Number 1, I'm caught my breath from all the stairs, so it's good timing. Will you all please bow with me? God, thank you for this day, and thank you for the blessing and the honor to get to be up here and be alive today, Lord, and to get to fight for the people of Georgia and to work with our colleagues up here, Lord. And Lord, please guide us and lead us as we try to make the best decisions with the information that we have for everybody in our state. In Jesus' name, amen.
Thank you, Chairman. All right, so Representative Chokas, House Bill 471, you are up. I'm not going to go in completely order here, but we're going to try to do it in a very efficient way. And so you're wherever you want to be. That is good. W3, House Bill 471, and we're on LC 570251S.
Correct.
Okay.
Thank you, Mr. Chairman, members of the committee. House Bill 471 is a water safety education bill. It emphasizes the importance of water safety education for children by implementing a video presented to new mothers at the hospital prior to being discharged. The short video will be offered to be shown before discharge at no cost to the state, with the video being prepared by the Department of Community Health in collaboration with Every Child a Swimmer Foundation. We have met with the Georgia Hospital Association, and they're supportive, and Senator Sean Still will be carrying it in the Senate, and I'll be happy to answer any questions.
All right, thank you. Any questions from the committee? So this is the hospitals are good with this. This is to be, shall make available.
Make available.
Make available, shall
Yes, sir.
provide. Okay. And Senator Orrock.
Thank you so much, Mr. Chairman. Thank you for the bill, Representative Chokas. I'm not familiar with Every Child a Swimmer. You're addressing a seminal issue of safety as far as I'm concerned.
That's correct. The foundation raises money to help create the video.
Very, very, very interesting. You know, taking a page out of Governor Miller's book a long time ago when they did you went home with your newborn with back in those days, whatever the technology was, but it was the little engine that could to help launch the bonding with the parents. So this does that as well as address this critical issue of water safety. And I'm interested going forward, and I'll talk with Every Child a Swimmer, looking at what we could do through the school system to provide more resources for children to.
That was, from what I understand, we do that already in the school system. So this is to catch them, you know, when they leave the hospital with their mamas, brand new babies with their mamas.
Thank you very much, and I'll follow up with the advocacy group.
Okay,
Thanks.
thank you.
Certainly.
Thank you. I'm all for water safety. I'm just trying to understand when this is for people that have just had a kid and they're in the hospital.
Mm-hmm.
So what's the video going to teach them? Is it going to teach them how not to let the baby drown in the bathtub, or is it?
Among other things, that's exactly what it's going to do. It's going to teach brand new mamas the dangers of water and how to prevent it and make sure that they don't leave the child alone and that type of stuff.
Okay, thank you.
Senator Still, you're carrying this, but you have some background in pools. You want to mind?
A little bit,
Helping out
a little
here?
bit. You know, 3.5 decades ago, I was the ambassador for Every Child a Swimmer program, and I've been with this literally my entire life. Drowning is the leading cause of death for children ages 1 through 5. So They learn to walk, they fall into a tub, they fall into a bucket. It is the number one thing that we can do. And yes, we'd love to reach mothers at a time other than the time they're delivering that baby because they're focused on a lot of other things, but it's the best opportunity we have to get to them before that baby comes to this world.
All right, any other questions? If not, I'll
Real quick, Mr. Chairman. Do you all have any data or statistics as to what difference, if any, this would make, even on the deaths of any hard numbers, if at all?
In terms of voluntary video that we're sharing with mothers at a time, I mean, we can certainly look at.
No, I mean as to the mortality rate of persons that may be in the water.
All
due
that's
to-
available.
Due to water.
Sure, if the chairman's fine with that, I can get some statistics to everybody on the committee tomorrow with just
I just
drowning
would like
deaths.
it.
And
Okay.
it's
Got it.
pretty readily available on the internet, but
Okay.
happy to get that
Thank
to
you.
Thank you. Anything else? At the appropriate time, it is now.
I would like to make a motion.
All right.
Chair, I move to pass.
Move to pass, Senator Orrock, second. And any further discussion? So we're on LC 57025S. No further discussion. All those in favor say aye. Aye. All those opposed, like sign. And passes unanimously. And Senator Still's obviously carrying it for you. And
Thank you, Chairman.
Thank you, Mr.
Thank you.
Chairman, members of the committee, and Senator, thank you.
Yes, sir.
all right, we're going to go a little bit out of order. We're going to say the best for last, so to speak, and we're going to go with House Bill 154, Representative Gary Richardson. I saw him earlier, and so
Yes, sir, Mr. Chairman. We will be, this is House Bill 154, LC 520767S.
wait a second. And is that what we have? I got 561133S. 461133S. Is that right? Okay. This is accurate.
Yeah.
So what was the number that you have?
LC 520767S.
We're on House Bill
154.
154.
Yes, sir, 154. Let's see. Okay, yes, sir. Well, okay, we did make one change to a code section. We added the 38-3-71. So y'all are on the correct.
We're on the correct one?
I had the wrong one, yes, sir, here. I'm sorry.
Okay, all right,
Yes, sir.
all righty.
Okay.
All right, so let's be clear, LC 461133S,
Yes,
House
sir.
Bill 154?
Yes, sir.
The floor is
154.
yours.
Okay. Thank you, Mr. Chairman and committee. I come to you to present HB 154. This bill designates EMS as an essential service. The public undoubtedly considers EMS to be an essential service. It is directly connected to the 911 system and is mandated by the state to provide pre-hospital care. EMS workers are the only emergency public safety employees in the state that are not considered essential. They regularly work alongside firefighters and law enforcement personnel, both are whom designated as essential. This designation would cover both public and private agencies. This bill does not grant new or additional authority, oversight, or regulatory power to any state, agency, or local government and will not affect current zoning practices. During COVID, services that were not officially essential did not have the same access to certain federal funding options and were forced to absorb additional costs through means that left them vulnerable. This bill is support for EMS, especially during disasters and pandemics when providers of 911 EMS services should not have monetary concerns. EMS is an essential government service that protects our communities and should be a priority. I ask for your favorable support and would be glad to answer any questions.
Certainly, we had nobody sign up, and we having questions for the representative? No questions at the appropriate time. Now is good.
Yeah, I would like to move do pass House Bill 154, LC number 461133S.
Sounds good. Have a second? Second, and any further discussion? No? All those in favor say yes, or aye. Sorry about that. And all opposed, like sign, passed unanimously. And who was carrying that for you?
Well, Mr. Chairman, it's Inman Quarters 4002.
Okay, all right.
And
So-
when I talked to one of the roommates, he said if the other one didn't want to, he'd be glad to.
Okay, I think that's me. So, okay, all righty. All righty, so, yeah, that's right. That's all for the internet there. Appreciate that.
Thank you very much.
Yeah. Okay. All righty. Okay, so House Bill 567, Chairman Dempsey. Let's see if we got the right LC number here. 461218S. Okay, floor is yours.
Great. Thank you so much, Mr. Chairman and members of the committee. So 567 will authorize and regulate the practice of teledentistry by Georgia licensed dentists and hygienists through the Georgia Board of Dentistry to ensure that patient safety remains the top priority while maintaining a continuous standard of care and sustaining the Georgia licensed dentist as the leader of the oral health care team. It will work with current general supervision law for hygienists and allow hygienists to work outside of the walls of a private practice setting in both safety net settings that were established in 2017 and other locations with the Department of Public Health. The premise is that the teledentistry bill is, while this can be a very positive encounter and useful as a modality for triage and consultation, due to the inherent tactile need for dentistry, if there is a problem, ultimately the patient still needs to see a dentist and receive treatment. Some of you may recall that this bill passed out of your chamber and ours last year. Since then, we have made a few changes to what you saw then, so I want to make sure that you're aware of those. So the language was removed that mandated the coverage of teledentistry by insurers to appropriately situated in insurance-related language in the relevant code section. It also amended in-person visitation requirements to allow patients without a dental home to establish a dentist-patient relationship through teledentistry. It also adjusted the referral requirements for enhanced provider flexibility to refer for patients to in-person care. It's much more functional than it was, and I think a very good way to help people who do not have access or have a dental home.
Oh, thank you, Chair Lady. Let's do questions first, then we do have one person who signed up to testify. Questions? No questions? All right, well, Dr. Petrie, did I pronounce that correctly? Okay. Dr. Petrie. If you just introduce yourself, who you represent, and, okay.
Dr. Lewis Petrie. Thank you, Mr. Chairman, for letting me speak. I represent, I'm Dr. Lewis Petrie from Winder, Georgia. Y'all may be familiar with Winder. I represent the Georgia Dental Association, and we have 3,400 member dentists in Georgia. I'm also a full-time private practitioner in Winder. We need this bill to clarify what we may or may not do with regard to the rapidly changing world of electronic remote access and health care. This bill clarifies the rights and responsibilities of dentists who practice teledentistry. The oral health and well-being of Georgia's citizens is a priority for Georgia Dental Association. Ensuring that all patients receive safe and ethical care is of great concern. In some areas of Georgia, accessing dental care quickly can be challenging. Teledentistry provides a valuable tool for triaging dental issues, helping determine whether a situation is a true emergency or if it can wait until the next day to see a dentist. In turn, the practice of teledentistry can help reduce emergency room visits by directing patients to the appropriate care. The bill also protects the citizens of Georgia by assuring that care is being delivered remotely is provided by a properly licensed dental care provider under the laws of Georgia. A priority of this bill is patient protection. Representative Dempsey went over some of our talking points, but I'd like to emphasize that providing patients that do not have a dental home the opportunity to remotely establish care with a dentist is very helpful in the underserved areas of Georgia. We believe this bill, as presented, will safeguard our patients and protect our profession from unlicensed or unqualified providers and give clear guidance to our State Board of Dentistry. Thank you. I'd be glad to entertain any questions.
Any questions at all? All right, number 8.
Thank you, Doc. I guess my question is, when we were using telemedicine a lot during COVID, I'm interested in the platform that would be used. Is this FaceTime, or is this on your EMR, or is this
Be similar to
a picture on the
FaceTime.
phone? How's it HIPAA protected and that type of thing?
That's a good question. It would be FaceTime, and so that would be something that would have to be worked out with the board. You'd have to have a permit through the board.
So Representative Dempsey, does it indicate that the board would need to promulgate rules?
It
Is that
does.
in here somewhere?
It is,
Oh,
it is.
Sorry, it's a lot of pages.
It is, I'm sorry. I wish it was not so long. Let's see if I can find it quickly. Well, it talks about, if you look on, can I find it?
Mine's
Oh, okay.
154.
Right, sorry, yeah. Very specifically, the board shall promulgate rules and regulations.
Okay, thank you.
Straightforward.
Any other questions? Okay.
Thank you, Mr. Chairman. As far as insurance coverage, does it cover at the same rate as it would as an in-person visit, or is the rate any different, or?
Can we let Janelle speak to that, or if you would prefer to with
It's up to
the
Jim.
Dental Association, would that be okay?
Sure. So I'm Janelle Adams with the Georgia Dental Association and the Director of Government Relations there. So we're not mandating coverage for insurance, and each insurance company could cover teledentistry if they wanted to in this bill, and they would be the ones that would set the rate based on rules set by the commissioner's office, the insurance commissioner's office.
Okay.
The teledentistry is not in lieu of an in-person visit. Those are not the same thing. Can't pull a tooth over a video.
Correct.
So it would be
Determined by the
rated.
insurance company.
Correct.
Okay. Okay. Thank you.
Sure. Any other questions? Okay. Thank you, Dr. Petrie. Appreciate you being here. Appreciate what you do. Be careful in Winder. Okay, no further questions for the author. I'll be happy to entertain a motion. A motion, so moved from the Rules Chairman, second from the Governor's floor leader. And any further discussion? If not, all those in favor say aye. Like sign, no. Unanimous. Thank you,
And
Chair Lady
Senator
Dempsey.
Still will be carrying this,
Senator
the man of the
Still is
hour.
the popular man of the hour. I like that. Okay, there we go. Okay. Chair Lady Taylor. All right, we're at House Bill 291. Get that a little bit closer and
Okay, thank you, Mr. Chairman, members of the committee. I appreciate the opportunity to bring this bill to you today. It's House Bill 291. We're working off of LC 570257S.
thank you.
This is a very needed bill. It concerns the community health care workers and having a certification process. Right now, this is going to establish a foundation and be able to develop a structure for those who provide health care assistance in local communities. It's going to identify who and what a community health worker is. It outlines what they can and cannot do. They will always be working under the direction of medical providers. The developed rules and criteria. This is to establish a pathway for them to become certified. It provides consistent training, uniform standards, and a certified competency. This is a vehicle to build and establish a certification program and provide additional health workers that are very needed in our, it's going to add credibility to the field. One of the things I can tell you, it's going to bring better health care resources to our rural and underserved areas. And it's going to align very well with the Department of Public Health's current strategy plan to increase the skilled public workforce to meet the state's needs. It's standardizing the entry into this community health worker workforce, and it's going to identify the core competencies. The impact of this is very, very important. A pilot program in Lowndes County shows an annual cost savings of $26,800 per patient with the utilization of these community health workers implementations. It ensures that healthcare services are accessible and culturally sensitive to different community needs. It's pivotal given Georgia's diverse population. It's going to be able to help those with our mental health needs and even the expectant mothers. Currently, there are several hospitals, including Emory, that have their own programs. This is going to align everybody to the same standards. By investing in the certification of community health workers, we not only enhance the workforce, but also pave the way for better health care resources in these communities. Our rural and underserved areas are really lacking with this kind of a personal touch. We need to recognize how important these vital workers are. I will tell you that a very, very similar bill passed last year. I believe, Chairman, you were the second signer on it, and it passed unanimously last year out of the committee. We've talked to the governor's office. They recognize this need for these workers, and I'll be very happy to answer any questions.
Thank you, Chair Lady. Any questions? We did see this bill last year, and we do have a couple people signed up. Jeff Breedlove, Julie Wyndham, both support. If you want to just, they support it and they waive. Thank you.
I had a question, Mr. Chair.
Okay, you're on W3.
Thank you for bringing this bill forward. I do think much needed. My concern is, how is this being funded? Is state funded? Yes.
Yes, it will be state funded, and it'll be under the Department of Public Health.
Okay.
That's where it's going to be funded under. And there are many, many people that have asked for this bill, so.
Right.
Yes.
I'm always worried because sometimes the state acts like we don't have any more money. So I just want to make sure that the funding will be there, for the duration of this program, because I do think it is needed. And I don't want us to get in a posture like, oh, there's no money for it anymore.
I do have a little say-so in a little bit.
I think you do.
So,
She's Chair of House Appropriations for
there you go.
Health. There we
okay,
go.
and I do have a
You
physical
will make
note
sure
for
we
it.
have plenty of money.
Yeah, I got
So
you.
Thank you.
a little, it is something. We do have a physical note for it. And
Thank you.
Thank you. All right, now, any other questions? No questions. I'll be happy to entertain a motion. All right, so move. Second, Senator Strickland. And any further discussion? No further discussion. All those in favor say aye.
Aye.
All those opposed, like sign, pass unanimously. And,
thank you so much.
yes.
I appreciate it.
And who?
I think Senator Anna Vitardi is going to carry it. He
Okay,
carried it last
great.
year.
That's
Thank
the
you.
way I remember it too. Anna Vitardi.
Thank you so much.
Yes. And the highest profile bill here, House Bill 428. Representative Franklin, 428, and
Thank you, Mr. Chairman.
yes, sir. And we did have a substitute, and I know you're going to go through that, but let's make sure we're all on the same page. LC 339818S. Okay. It is not on, but it is
Okay.
now. Sorry about
Yeah,
that.
no problem
Okay.
at all. So I just want to thank you and your committee for hearing this bill. I know that the hour's getting late and we're seeing a lot of bills, but I do really just want to say thank you for taking the time to hear this. For me personally, it's a super important bill, but I just want to begin by saying that in this legislation, that we're not going to do or create anything that's not being currently done in Georgia right now. This bill doesn't change anything in that nature. All it does is codify the process of IVF so that all the Georgia families can continue to have this process, and so that nothing hampers that. And that's the heart behind it, and that's the goal behind it, and that's what this legislation does. But I also just want to, and I can go deeper into that as well if you like, but I just want to add also that it passed the House with 100% unanimous vote. There wasn't one person that voted against this. And that, to me, just says that everybody in that chamber has some sort of relationship with this process. When I was going around and getting support and getting signatures, I heard story after story after story about how IVF was indirectly or directly affected these individuals' lives, whether it was them personally or whether it was their children or their grandchildren or their neighbors and friends, whatever. They knew somebody that has gone through this process and had the miracle of having a child through it. And so it was really an amazing thing for me to see and to witness. And I know, time is short, but just briefly from my story, my wife and I, we've been trying to have children for over 8 to 10 years when we got married, and it just, it didn't work out. We tried everything, and we did IVF, I believe, 4 times, hormone therapies, and we even tried to adopt, and that fell apart basically within the last 2 weeks of that child being born. So we've been through this process and very, the roller coasters that come with it, in a very personal way, I suppose. So when the opportunity came for this bill to be codified in the law and to protect it for Georgia families, I jumped on it, was super happy to do it. And so my story is just one of many, like I was mentioning. We have another family in the audience. If you want to hear from her, any details in the process, there's a doctor here as well, and also an attorney. But I'm happy to answer any questions you may have as far as the bill.
Let's see if we have any questions from the committee. Have no questions. We had a lot of people sign up. Why don't we just get everybody to speak or wave or whatever they want to do? We do have a little bit of time. In order of people who signed up, Lynn Goldman, then Andrea Kerr. We're not going to put anybody on a time clock here, but.
I'll be quick.
Okay.
Good afternoon. I'm Lynn Goldman, and I am the president of the Georgia Fertility Network. I'm also the mother of twins through IVF that are now happily taxpayers here in Georgia. So I'm very grateful to have IVF exist back 23 years ago, and I'm very much in favor of it existing moving forward. And to keep it brief, because I know there's a lot of families here that you want to hear from, we just ask Georgia Fertility Network and myself, I ask that you support this bill. It is hugely important in light of everything that is going on around the country, that our families in Georgia know that IVF is safe here in Georgia. And I would ask that you vote in favor of it.
Thank you. Any questions? All right, so Andrea Kerr, if I pronounce that correctly or incorrectly?
Yes, you did. Andrea Kerr. Thanks. Good afternoon, members of the Senate Health and Human Services Committee. Thank you for allowing us to share our voices with you today. I'm honored to be here and ever so grateful for the science and marvel of IVF. we're here to urge your support for House Bill 428. I'm Andrea Kerr, and alongside my husband, Patrick, we are the proud parents of Benjamin, Elliot, and Gavin. For a long time, we dreamt of our babies' faces. We wondered if we would ever be lucky enough to know them, but thanks to IVF, we do. This month marks 15 years since we first sought fertility treatment. We relied on the expertise of Dr. Catherine Calhoun at the Atlanta Center for Reproductive Medicine after years of family planning on our own to no avail. Our 5-year journey with Dr. Calhoun was marked by the excitement of treatment cycles that worked, coupled with the devastation of the cycles that failed. We lost pregnancies, one baby after another, after another, after another. Without going through this process, I don't know that I would appreciate all the things that have to go right in order to have a successful pregnancy and birth. However difficult our path to parenthood had become, Dr. Calhoun persevered, so did we. We could have given up. We had every reason to do so. But we trusted the science, and we trusted her, and Patrick and I brought home our first son in 2015, and twin boys followed the year after. Our home is so loud and happy, and it's full. And in vitro fertilization is the perfect combination of hoping and wishing for something when it's not guaranteed. We bet on ourselves. We dedicated all of our resources to something when the odds were so stacked against us. It's the ultimate act of trust, trusting experts who dedicate their careers and their livelihoods to ensuring that people like me in the state of Georgia have a chance to create a legacy. In vitro fertilization is more than the scientific protocols and medications and surgeries and appointments. It's finally being able to hang the extra Christmas stocking on the fireplace mantle after saving it for one day, just in case. It's decorating our nursery after the upstairs room sat dark and empty and cold for years. It's teaching my twins how to ride a bike, watching them barrel down the stairs on Christmas morning. It's cheering them on at their Little League baseball games. It's singing happy birthday over a cake and watching your firstborn child blow out his candles. None of this would have been possible without the science, the expertise of our providers, and the legislature that protects it all. I'd like to thank Chairman Ben Watson for prioritizing this for Georgians and Lehman Franklin for bringing the bill, and I urge you all to vote yes on this bill. Thank you.
Thank you, Ms. Kerr. Any questions? Okay, thank you. Jennifer Collis. I'm sure I didn't get that last name. That Emily Loblow is next, and Alexandria French.
Thank you so much. My name is Jennifer Kawas. I am a reproductive endocrinologist, so I'm a physician that provides fertility services to the citizens of Georgia. And I just wanted to thank you all for considering this bill, and I wanted to say, nothing speaks more strongly than a patient's story. Even after doing this over 15 years, that story brings tears to my eyes. I can say that I meet with patients every day and probably cry tears of joy with my patients every week. I don't know there are many people that can go to work and say that. And I can also say that in the current political climate and with things that have happened in nearby states, patients really ask me every day, am I still going to be able to build my family? Am I still going to be able to access services? What should I do? And they are very, very concerned about whether or not they're going to be able to continue to have the opportunity to pursue family building. For many, many patients, IVF really is their only option. There are people from all walks of life with no medical problems, no family history. Infertility really, it truly affects hundreds of patients from all different backgrounds with all histories without any risk factors. And so I just ask you all to strongly consider supporting this bill. I really do think it is so important to Georgians to continue to have access to the opportunity to build their families. I'm happy to answer any questions. Thank you so much.
Any questions for Dr. Collis? No? Thank you very much. Thanks for what you do. Emily Loblow, and then Alexandria French, then Zach French, or maybe Zach and Alexandra together. But Ms. Loblow. I
Hi.
did not pronounce that correctly, I'm sure.
Oh, it's Lobello, but we are, I
Okay,
think, all
sorry.
very
Okay.
thankful to be here, and Chairman Watson and the committee for the opportunity for us to share our proud parent stories. And thank you for your work to let us be here and tell our stories and consider codifying IVF. In 2014, my husband and I welcomed our son Sammy, and at that point, I will say, took for granted how easy it was to get pregnant with him. And then 6 years later, when we were ready for our second child, everything changed. I suffered miscarriage after miscarriage, which can happen when you're older. And as I neared 40, time was no longer on my side. I turned to IVF, and the amazing Dr. Kawase you just heard from, who is a amazing scientist and also an artist and guide through this process. After months of physically and emotionally exhausting treatment, we had just one viable embryo, one chance at our second child we wanted so badly. And luckily for us, that one chance became our daughter Mia, who is now 2.5. And she is a wild, smart, funny little girl, and running us through the mill of being parents of a toddler. And she is also just a miracle of love and science and nature that statistically should not be here. So we are grateful every day for this technology and the great doctors at Emory and Georgia who were here to bring it to us. Thank you so much for considering this bill, and let us know if you have questions. Thanks.
Thank you, Ms. Loblow. And Alexandra and Zach French, are you together? Same last name, could be. Okay.
Hi, my name's Alexandra French.
Hey, I'm Zach French. I'm her better half.
We stand before you today not just as residents of Fulton County, but as parents whose journey to parenthood is completed because of IVF. I never expected to face a battle for my own fertility, but when I was diagnosed with breast cancer at 31, that choice was taken away from me. My doctors told me that life-saving treatments would leave me unable to conceive naturally. In an instant, the family that I had always dreamed of having was at risk of disappearing. Thanks to IVF, I had a chance to preserve my ability to have children. Science gave me what cancer tried to take away from me. My daughter exists today because of IVF, and I cannot imagine a world where others in my position would be denied that same hope. I urge you to protect IVF.
Can I submit something into evidence? I've got a nice picture here. Just kidding. She's cute, right? A little biased. Listen, there's not much to add to that. She is the rock of this family. She is the one that fought breast cancer, and IVF is what allowed us to grow our family. I think the only thing that I really want to add is that you hear a lot of people come up here with a lot of passion. We're all here because of this. I've even upended my career as an attorney and an executive just to be in this field full time, now serving on the board of Georgia Fertility Network. And that's because we're so passionate about seeing fertility preservation and really family building be preserved so that everybody has that opportunity to grow their family. And I want to thank the Lieutenant Governor as well for having us up here, and we hope that you'll support this bill.
Thank you. Thank you so much. We appreciate your story. Rachel Guy and Suzanne Guy.
Good afternoon, everybody. Thank you for the beautiful testimony shared, and it's a privilege to be here. Thank you for having us. I would like to share, and then my daughter, Rachel, would like to share something. We are here today to request that amendments be added with regulations for IVF. We are not against IVF, but we have some very deep concerns that most people are unaware of the number of children that are discarded, tested on, and killed in the IVF process because there is no regulation. I think most people are like my husband and I were about 34 years ago when we embarked on a very difficult, lonely, sad journey of infertility. I have the deepest compassion for everybody that is shared here today, because I can think of few things in my life that led me with such heartbreak and despair, crying out to God, asking, why? And in the journey, we were referred to a fertility specialist. It seemed kind of crazy. I thought, we can't afford this. But in utter desperation, I went to an appointment to talk to this fertility doctor. And as the doctor was telling different things that could be done, he shared about IVF as an option. And to his credit, he shared a lot of details about IVF. And I started to ask him questions. I said, well, what do you mean by selective reduction? I know what selective is. I know what reduction is. You're telling me that you would intentionally end the lives of some of my children, depending on how this goes. And he said, yes. It was at that point that I, brokenhearted, said to my husband, there is no way we can do this because many lives will be at risk. So we are here today because most of the public is unaware that for every live birth, and praise God for that live birth, there are children who are tested on, who are killed, who are treated like property. And we have a duty to regulate this industry that is built on greed and deception and unethical practice. And you guys, we cannot stand by knowing what we know and not sound the alarm. Yes, we want IVF. We want to see couples like my husband and I have an opportunity to have children. But we must sound the alarm that in that process, because it is so unregulated, it is unethical. And I would like to challenge each of you that I admire and respect, some of you I even know, to do your homework and to just not blindly sign off on this because the stories of desperation, because there are stories of children treated like property who are dead because of this reckless industry. Challenge me. Do the research. You can say she's off her rocker. Do the research and see what you find out. What we are asking is, please do this process ethically. Limit the number of embryos created with each IVF cycle, because if you don't add regulations, Georgia will have blood on her hands because there will be dead children at the earliest stages. Thank you for your time and thank you for listening.
Thank you, Ms. Guy. Suzanne, did you have something to add? Or?
Oh, this is Rachel. I'm sorry.
I'm sorry, I didn't have the names confused. I apologize.
Hello, my name is Rachel Guy, and I am from Cobb County. I recently got my master's in bioethics, and so through that I had the opportunity just to do extensive research just regarding, just the IVF process in the industry. And I really found out that there were so many unethical and broken aspects of the industry that were really not known to precious couples. And what I would love to see is I'd love to see there be amendments added in this legislation to see that only the amount of children that would be implanted inside of a mother's womb would be created. I think that this would be wonderful just for many aspects, but I think one of those is the fact that, heartbreakingly, in a typical IVF cycle, there are 10 children made in a cycle, which is beautiful. But of those 10, only one really takes I would say typically probably makes it to live birth. And that is because those other 9 are not given care, are not valued by the IVF industry. These children are tested upon. These children are sent off for research. There is a test called PGT, pre-implantation genetic testing. If this child is deemed to have Down syndrome, cystic fibrosis, fill in the blank, that child is killed. From my understanding, they're thrown in the trash. And when I think about just the IVF industry and the heart of it, to see precious couples have little ones, I think that these families, deserve so much better, and the IVF industry, I think that they can do better by really seeing these precious patients at the youngest, smallest stage of development not killed, by seeing that the amount of children that are implanted inside of a woman are created. Thank you for your time.
Thank you, Ms. Guy. Do we have any questions from the committee? Representative Franklin, you have any closing thoughts? Okay. Senator Brass is on 3.
Thank you, Mr. Chairman, and Representative Franklin, thank you for bringing this. Is there, under current law, is there any regulations around, I mean, is IVF even recognized in state law currently?
What we have here, and I just want to thank the last couple that spoke. One, because I think every voice needs to be heard.
Correct.
But the good thing, and I'll address the answer to your question this way. The good thing about this bill is that it doesn't go into the details of that.
Right.
All this does is codify what's actually happening right now to make it actually to begin to regulate it, to make it safer and to be better for those Georgia citizens that want to have it. So those issues are there, and I'm happy to have those debates and go into it. But the good thing about it is that everyone on this panel can lay their head at night knowing that this is a non-issue for this bill because it doesn't dive into it.
This
Looks
bill
like the doc can answer
establishes.
my question.
Well, let me see if I can help clarify.
Okay.
This bill establishes in code that in vitro fertilization exists. In reviewing and discussions with the previous author, actually Ed Setzler, for the heartbeat bill, his legislation addressed it. This clarifies it and puts it in code also. And that's sort of where we are. This is not a regulatory bill.
So essentially, but the purpose, I'm just trying to understand the purpose. We're putting in code basically a definition the state is recognizing it, right? Because, I mean,
correct.
it is new. We probably don't have any, and I faced something similar with a totally different bill that not near as important as this, but it dealt in the financial world. And the point of that, I was trying to establish definitions so that moving forward, when we were going to regulate it, that we were all kind of speaking the same language. And so I'm trying to get an idea, is that kind of the purpose here? Is let's establish first in code what it is, and then we can come back one day and start figuring out how we're going to regulate it. So at least now we're all speaking from the same sheet of music.
That's exactly correct. Yes, sir.
Okay. I'll just make sure I understood that. Thank you, Mr. Chairman.
Thank you, Ms. Chairman, for clarifying that, and Representative Franklin. And there's a question for Senator Kirkpatrick. Dr.
Thank
Kirkpatrick.
you. I was just noticing that's in Title 31, and when I look up Title 31, that puts it in the Public Health Department. Is that correct?
From my understanding, yes, ma'am.
Okay, thank you.
I would like to add one thing if I could. Georgia.
Certainly.
I just want to add for the record, I don't think I told in my testimony that my wife is actually pregnant. I don't know if I mentioned that. So
How far along is she?
She's great. The due date is June the 3rd, and the baby now, it's a little girl. It's on 2.5 pounds. I just found out about 3
wow.
days ago. So ecstatic about it. So I just want to add that in there. So thank you.
That's a good ad. Any further discussion or questions? If not, I'll be happy to accept a motion. Motion do pass from the chairman. Second, Senator Huffstadler, Chairman Huffstadler. Any further discussion? Let's raise our hands this time. All those in favor? That's unanimous. Thank you. Okay.
Thank you, Mr. Chairman. I appreciate it. Thank you, committee.
And
I was hoping you would carry it for me.
be happy to.
Thank you, sir.
Okay, thank you. I didn't want to say this before the meeting, but we did get through all those bills, and we have run out of bills. We've been efficient, and no, we don't want any more from judiciary, especially, and hopefully we haven't jinxed ourselves. But this may be our last meeting. If not, meeting's adjourned. Thank you very much to the committee for being a great committee. Thank you so much.